What are you doing in here?
There were no tests ordered, and the baby has a murmur.
I know.
He turned blue.
Your surgery, you're not authorized to be in here.
Are you going to do any tests?
It's a benign systolic ejection murmur.
Are you sure it's benign?
There's a baby up in peds. I saw him have a spell, and I think I hear a murmur. If you could just go up and look at him.
Not without a peace consultant. I'm a busy man, Gray, and there are rules.
You are so out of line.
She says the murmur might not be benign.
If our baby is sick, we want him treated now.
Who said your baby was sick?
Her, the surgical intern who has no business on our service.
Who authorized you being here?
Actually,
Are you messing with my intern, Dr.
No, sir.
Give me the chart.
There's nothing wrong with him, I checked.
You can guarantee that he's fine. You're 100% sure.
How sure are you?
I don't know, 75%?
Not good enough. He's my patient now. We're gonna run some tests and get you an answer within the hour. I want an EKG, chest X-ray, and an echo. You were right. Booking the OR for tomorrow.